In specialty healthcare, growth is not optional, but scaling with operational excellence, that's the hard part. I'm Joe Zboch. This is Scaling Specialty Growth. Today's guest is Dr. Matthew Slater, Administrative Director of Orthopaedic Surgery, Trauma, and Burn Services at UC San Diego Health. UCSD is the only academic health system in San Diego ranked nationally for orthopedic care and home to the first spine program in California to earn the Joint Commission's Advanced Certification in Spine Surgery. He believes operational excellence directly shapes a patient's experience from first call to last post-op check-in, which is why I'm excited to have him on the show. We're digging in deep into his work to scale specialty growth without losing what makes the care great. Matthew, welcome.
Awesome. Thanks, Joe. Happy to be here.
I'm excited to get going. So the first question I have is really just how do you think about hitting organizational growth goals while maintaining operational excellence? And in that, I do want to break like a cardinal rule in podcasting, it feels like, because you wrote something pretty recently that I thought was really great. You wrote, sometimes growth doesn't come from climbing higher or pushing harder. Sometimes it comes from seeing differently, which is pretty cool. So Thanks. I'm curious how that perspective shapes how you think about operational excellence and the balance of hitting goals. And I know people is a really important factor to the work that you do.
Yeah, absolutely. I think it's funny you said we'll start with a question. I feel like that could be an entire show or maybe a couple series. Like that's a pretty big question there. So we'll try to break it down in smaller bites, right? So thank you for kind of commenting on what I mentioned and what I posted, as well as kind of the patient and people aspect of it. I don't think that in healthcare we sometimes recognize enough of how challenging things are for our people and how important that patient experience is, right? There's certainly different areas of the country where maybe there's a mom and pop type physician's office where it's, one doc, two docs, and a receptionist and a medical assistant. And maybe their growth plan obviously would look very different than, say, somewhere like where I am. And we have multiple competing health systems in San Diego. We have, hundreds of orthopedic surgeons. There's, a lot of competition. And so how do we grow strategically where we are? And I think that goes back to kind of what we're talking about. How do you create an experience for patients that they want to come and they want to experience what you have to offer? You can be like the best of, nationally ranked, and you can have the funnest tools and toys and imaging equipment and all the things. But if the patients don't walk in and immediately feel welcome, if it's not an easy way to access an appointment, if you're making unnecessary barriers to getting that care, then those patients are going to go elsewhere, right? I always relate to my teams when I'm talking about experience, and I say, we're unfortunately not in, the hospitality industry per se, right? We're not sitting there on this beautiful beach at this great hotel where we get to welcome people on this beautiful vacation and like, how can we make your stay better? Oh, I want an extra towel, right? That's not how we get to roll. But our patients' experiences or expectations are getting to that level, right? They're getting to the level of when I come, I'm paying thousands and thousands of dollars out of my pocket. My insurance is paying all this money. I've got this high copay, this co-insurance, and I expect really good treatment, right? I expect not only expert doctors, but I expect that people are going to take really good care of me while I'm there. And so that's where, to me, like, you can't lose touch of that, like, experience. You can't lose touch of your vision, and you can't lose touch of, like, what the grounding factor is. You look at it like kind of Maslow's pyramid, right? And the hierarchy of needs. You can't build this incredible building or this incredible thing on a base that's shaky or doesn't really have what you need. So you really have to focus on, how do I get those patients in the door? How do I make sure that their experiences, that they want to come back and they want to tell their friends about us, right? And then how do I continue to grow that? And there's a whole lot of factors that we can talk about as we kind of dig into this. But I think those are kind of that, foundational factor that I would say is part of, my perspective on how we approach things from the patient's lens in order to create that somewhat organic growth, right? Because if you build it, they will come kind of thing. If you build that experience, if you build that high touch, high feel, almost boutique-y feel when you come to a doctor's office, you're going to want to come back. And so how do we start with that and then grow from there?
Yeah. Quite a few things to unpack there. I think it's fair to say that patient experience historically has felt a little bit fuzzy. But like there's some very specific ways that it surfaces that whether you're a provider, whether you're in leadership, you notice. And one of them is just like in Google reviews, when there's a low Google review, a lot of times it's not about the quality of the care per se, but rather the operational experience. And so this kind of leads me to my question is clearly you've spent a lot of time internalizing how to best frame the value of experience for an organization. So how is that message different from what you mentioned, the folks on your team and saying, hey, we're not necessarily hospitality, but our patients are making a real investment, so let's do our best here. And then on the other end, the leadership side of things that, to paint with a broad brush, perhaps unfairly, are going to say, yeah, so what are the numbers? How does this either drive growth or like, hey, we just opened up this new facility. Like, what do you mean experience? Like, let's just get people in the front door regardless, no matter what. How do you frame the message of experience based on the audience you're talking to?
So I think, there has to be alignment between both. And I say too that like for our teams, patient experience is important, but my team members' experience is also important, right? We've gone from a high turnover in my department when I kind of first came to significantly less now. And part of that is because we have tried really hard to listen to our team members, to allow them to be part of the problem solving, to make sure that we're supporting them, then to also help them grow in position. So most of the turnover I've had recently has been team members promoting within, my area or in the organization, which is great, right? That's what we want to see. So we're working to make sure that their experience is good because again, like that's our foundation, right? And so if they don't feel good, they're going to have a hard time turning around and delivering that experience to others. And so there has to be that connection. There also has to be the connection between, kind of as I was mentioning, if I'm sitting in, the executive team meeting with my COO, CEO, whoever, finance, whatever it may be, yeah, they're going to talk numbers, and that's fine. I don't expect anything different. That's what we should be looking at. But what's going to matter, and is that we have to look at how do we attract those patients that we want to have in the doors that are important to us, that help with our bottom line, that help with our numbers, all those things. And that includes by leveraging having an exceptional experience. You're right that I couldn't say it better, that oftentimes when we get these negative reviews, and I check my patient experience comments every single week, and so when we get those, it's often a process problem. People don't like the parking situation. They don't like, the way the building is set back from the parking area. These are all fair things. I mean, it's things that I would consider like as an ortho patient too, right? And so I think that there's some of that, and it maybe took too long to get a message back, right? So anytime we get those, we look through like where could we have done better? How could we have made sure we set expectations the right way up front? Like, as you come in as a patient, here's what you can expect after your visit. And so one of the things we do, or we implemented recently, is after every visit, we send a text message to the patients and say, thank you for choosing us and trusting us with your care. Just so your MyChart portal is available 24/7. If you have any questions after your visit, you can send us a message. Please expect a 3 business day turnaround time. So we're immediately establishing what those expectations are. If it's emergent or urgent, here's the phone number to call. And so like as I walk out of the building, I get that at the end of my day. As a patient, I'm able to say, okay, these guys, they care about that I came there, and now I know how to get somebody if I need them. And it's been really helpful. We've actually seen a big jump in our experience scores, specifically in the category of patient knew what to do after their appointment. And so when patients are in a market like ours, they're going to sometimes go choose different doctors, right? They're going to doctor shop a little bit. They're going to go to another group and see how they are. They're going to come here. So when I talk to my executive team, it really is we have to continue focusing on that experience. And what I'm very fortunate is our executive team here is heavily focused on experience, right? This is something that's super important to them. It's also becoming more and more important in the national standards for different payers are looking at it. Different organizations that do certification bodies are looking at it. How do we respond to complaints? How do we respond to issues? And so it's become like like there is there, like you said, it's kind of previously fuzzy, but now it's not so much, right? There are actual dollars linked to patient experience scores, and how do we capture those? And then additionally, I think there's always been this, well, patient experience is, saying, please and thank you. But it's not just that, right? It's actually, there's data behind the fact that your experience as a patient directly impacts your outcome. If I know as a patient that I come in for surgery, I have my surgery. Afterwards, I know exactly who to contact. And if there's a problem, I contact that person and I don't end up back in the emergency room. I don't end up as a readmission. I don't end up costing the health system more. And so I think the way that you translate that is I'm working, back to your question, I'm working with my team to make sure they're supported, right? That's first of all. I'm then making sure the executive team understands where our experience is, where our opportunities are, and how do we get better at those. And then we're continuously trying to be ahead of the curve on that.
Yeah. It can be easy to forget that being a patient is pretty difficult. As the patient, you are the one constant across workflows, across departments, across providers. And obviously, as a consumer of healthcare, I've been in between providers and in between employer benefits and in between payers. And, it can be a lot of work, especially with complex and complicated care. As a kind of the academic medical center side of things, a lot of times a growth lever and a quality lever are very similar. And I imagine the types of cases that y'all can get might be on the more complex side of things.
Right.
And so there's this idea that I would imagine you're having to remind your team that, like, hey, our everyday is hopefully this patient's once in a lifetime, right? And so, like, we don't want to assume that they know how my chart works. And so I really like that you have that follow-up text. And I want to talk on one thing that you said earlier is we talk a lot about the patient experience. You obviously care about the staff experience. A lot of times, especially with coordinator roles or access roles, that can be high turnover, and you've been able to really make that a lot less. And so there's this idea of, well, the next question is going to be about growth initiatives, perhaps. Growing people seems to matter to you just as much as what you're doing externally in the organization to drive more foot traffic and digital traffic to your front door.
Yeah, absolutely. And I think part of that is, right, we can't grow volumes without people, right? I've got to have the right people in the roles. A peer of mine at another UC institute, when I went on a tour there, shared with me her hiring philosophy, and that's everybody has a group interview with some of the peers they would have. And then all of those people in those interviews give a rating to that person on a number scale 1 to 10 based on their interview. And they only hire 9s and 10s. And everybody in the panel has to say that's a 9 or a 10. If one person says 8, it's out, right? And so, and you can see and feel that when you go to her space. Like, it is just incredible. We've adopted that, and I think we've had just an incredible outcome from that, where we are really searching for the best of the best. And that helps us with kind of those turnover and, making sure that we're hiring the right people, and also making sure that we're matching, people to the right job. And so when we have positions open that are, coordinator positions, auth positions, forums, whatever they may be, we're really looking at the pool of people that apply. We're fortunate that we get big applicant pools working for the university, but we really look at that and say, who's the right person for this role that's going to deliver the experience we're looking for and also feel satisfied with the job, right? And so that's been really helpful to us as we look at how do we maintain those people. But again, if we're talking about growth, I got to have the right people in the roles to then grow additional volume. Yeah. And then that means additionally, if I hire, 1, 2, 3 more surgeons, all of them create additional work downstream, right? So they're creating additional paperwork, they're creating DMV forms, they're creating all of the things that go along with being a surgeon. So I have to have the team to do that. We can't just always say, well, Joe's going to pick up the extra work, like, because Joe may already be like overloaded. And so I think having that open communication with our teams is really important too. Consistently saying, how are you doing? And not like, how's it going? but like really meaning it. How are you doing? My team is comfortable enough to tell me like, I'm not doing well and this is why. We have in-depth conversations about it. It may not even be something at work. It may be outside of work, but we'll talk about it and then we'll work on a plan to come out of it. And so I think, when we're talking again, we talk about growth, we want to grow, you got to have the foundation in order to do so. Or what's going to happen is your experience is going to tank. The growth that you've created is going to have, not as good of an experience or satisfactory experience. And then, as we all know, bad press travels much faster. And in our line of work, bad press isn't the same as good press, right? So, I think there's a famous quote: "Bad press is any press is good," but not in our case. So we don't try to do that.
Yeah. So talking about growth initiatives, whether it's the operational infrastructure to support the growth or the hiring of new docs, what's something that you worked on recently that you're proud of in terms of the work that the team did or the impact it's had on staff or on patients?
There's a lot of things. So one of the things that I feel like we've done really well is, strategically recruiting into positions that we need for providers in terms of where our gaps are in terms of access, right? So, we don't just say, hey, let's bring on a bunch of new providers. We look at where are our access issues. Is that hand, foot and ankle, PMR, joints, whatever. And then we really build our initiatives around that. Orthopedic care is a huge percentage of healthcare costs, and it's only expected to grow more and more. And so, how do we make sure that we're positioning ourselves to accept the type of patients we're going to need? If you had said 10 years ago, every joint you guys do is going to be outpatient, everyone would have laughed at you, right? But that's not the case anymore. Now it's, almost 90% of our joints go home same day. And like you said, or within 23 hours at least. And like you said, it's about making sure we have the right people and kind of that right setup in order to execute that. And then how do we market to like, that's what we're looking for. Like, this is what we're trying to do to scale that growth.
Yeah. I'm curious, what does that look like from a digital front door, from a marketing perspective, from getting the word out there? Once you've done the data work to identify the access gaps and you've kind of done this strategic hiring process to fill those gaps, is it the case that the demand is just there and now you're able to more confidently route to those folks? Or, yeah, what is that?
Yeah, so I think that the demand is certainly there, right? We have a huge demand. People want to come see us because we're the academic institute in the town. UC San Diego, I think, really turned the corner during COVID when we set up the Petco vaccination superstation. It was the first one in the country where, we were giving out so many vaccines. We were making sure that people had what they needed to be cared for. And I think the community saw us step up in that regard and was like, wow, these guys really are out there for us. So now we have, a ton of people that want to come see us, which is great. But again, making sure that we're set up for what the future is so important. And so I think, when we bring these providers on, really looking at, I work with our business development team. I'm a phenomenal partner there. And we will kind of look at what's the right way to market this. Is it going to provider groups? Is it going to, sending out info? Is it doing a news brief? Whatever it may be about what they have to offer, especially for anything that we're bringing on that may be new or different than what we've had before. We want to make sure and get that out there. So we definitely work on, advertising. We've got a new provider. It's them. They'll go out and do, the providers themselves will go out and do lunch and learn kind of things with people and go to other provider meetings and stuff. And we try to do that the right way. And I think that we're getting more advanced in some of our marketing techniques, right? Where we're going to look at different ways to do things based on, AI or whatever it may be to help us like really dig into what's the right way to grow and to grow in the directions that we want to grow. And so I think that's kind of where we are on that.
Yeah. What are you working at next that you're excited about? I'm sure you got a lot of things on the plate.
I do. So I'm glad you asked because I'm very excited. We are working on opening a 4-story, beautiful musculoskeletal neuro-focused building. We're slated to open in 29. It's going to be incredible. We're very, very excited. We have advanced imaging, urgent care, 23-hour stays, operating rooms, clinic space, physical therapy, rehab. Just so many awesome things where it's going to be a one-stop shop for our patients, right? So they could literally presumably come into the urgent care because they had a fracture, say, okay, your fracture is significant enough. I need you to go see the surgeon upstairs today. They take the elevator up to the fourth floor. They see the doctor, and the doctor says, I really need to operate on that today. And they go down to the third floor where the operating rooms are and get checked in and make sure they meet the anesthesia things. And then they have surgery that same day. And then they stay, for however many hours they might need after to recover. And then they go home. And so I think like the fact that we can do that is pretty insane. Operationally, we're not there yet. So let me caveat that. Like it's going to take some coordination between a lot of groups. But the fact that we're like
it's like a whole MSK health system in only 4 stories.
Yeah, literally. It's going to be incredible. So we're very excited for that. And obviously that's a project we've been working on for a few years now. But when you're talking about growth, right, I put a growth plan out for my physician recruits out to 2034 so that I can like really look at what am I looking at? What is the market doing? But it's funny I was talking to one of our directors in IS earlier about the building, and we were talking about, what kind of computers we want. Do we want like workstations on wheels? Do we want, wall mounted? And I'm like, I don't want any of those. Like, I think I need us to be building this building for 2034 and what our technology may look like then. Now, I know no one can, predict that, right? Because technology changes so fast. It's, unbelievable. But that's how we've looked at this whole building, right? We build it with so many outpatient ORs because of all the things coming off the MSK inpatient only list. So we're building out to meet what the future of MSK care is going to be, because it's not always going to be inpatient. There's a lot of spine things that are going outpatient that used to be in the hospital for a week. Even like we talked about, joints were in the hospital for 5 days. That's no longer the case. So how are we going to make sure that what we're building is meeting the needs of the future and not like today or even what we anticipate in 29? But that's when the building opens, right? And so we expect this building to have a life of however many years. We need to be planning for that. So I'm very excited for that. That's what's on our horizon.
Yes, I love that. One final question for your peers that are in the operational space, maybe just a piece of advice to help them take the next level that you hold kind of close and that you remind yourself of.
Oh, that's a good one. So I just gave a talk at AOE on my history as a flight nurse. And so when you're a flight nurse, you're working in a space that is 12 feet long, 5 feet wide and 4.5 feet tall. Can't tell because I'm sitting, but I'm 6'1". So I'm already cramped in that space. Then you have a patient laying on a gurney. You have whatever equipment you need to keep that person alive, and you have one other nurse, a pilot, and a co-pilot. And so what I talked about in that is that as leaders, we have to stop being so fearful of making decisions. And we get into this thing where it's just absolutely analysis paralysis, death by data, whatever you want to call it. But, my key line and one of the key lines in the talk was like, you don't need more data. You really don't. Like, you don't need more data. Like, you have to be able to make a decision and realize, was it the right decision or not? I don't know. And then you pivot if it's not, and you make another decision. Your teams look at you and expect you to be that leader. And the lack of a decision or an indecision is a decision in itself, because people look at you and say, wow, they can't even make up their mind or whatever it may be, see you dragging or stalling or whatever it may be. So it's really decide, communicate, whatever it may be, and then take action. Do I need to pivot or not? And I learned that because people will tell me, wow, you like come to decisions really quickly. And it's because I had to, right? As a nurse, when I've got and I'm 42,000 feet in the air in a flying tin can, and I'm trying to keep somebody alive, like my job was really to be able to make decisions, use my brain, and move. Like I didn't have, everything you have on the ground. I didn't have an Epic. I didn't have an EMR. I had nothing, right? Besides a little pocket drug book. And so I think part of that is like really that ingrained in me. You're very unlikely going to make the wrong choice. And if you do, it's also okay. Like it's okay. And you make a pivot and you figure out, well, how do I fix it? Right. And so that's what my time goes back to. And I think if I can leave everybody with that, like, don't be afraid to make the choice and go after it. because you're going to get stuck in your analysis paralysis, and it does not do you any favors or anyone on your team favors to sit in that state. You just need to make the choice and move with it.
Matthew, thank you so much for being on the show.
Yeah, it's my pleasure. Thanks for having me.
Hey, it's Joe. Thanks for listening. If you like what you hear, share with a peer. And if you're looking to scale referral operations to drive growth and efficiency, visit hatchcare.com.